Okay, I have two people on, one person on the iPad and three people on the phone. Death is a topic that no human being wants to talk about, especially their own. Hospice care has a very negative connotation attached to it. It's actually meant to be a very positive aspect of care in the negative progression of a disease process. Webster Dictionary states that hospice is a program designed to provide palliative care and emotional support to the terminally ill in their home or home-like setting so that quality of life is maintained and family members may be active participants in their care. My personal description is a little different. Quality of care provided with comfort and peace through support, equipment, and medication in the home, eliminating the need to go to the hospital and doctor as the care comes to you, allowing your family to focus on achieving the highest quality of life in a difficult situation, raising your family members up with support and knowledge to be able to administer the care that you desire and you deserve. A delay in care with hospice is unnecessary at times. Through purposeful acts, the delay can be eliminated, increasing a person's quality of life. I had the honor of being with my grandfather as he was on hospice for 3 months. Through the care that we were provided, this caused me to pursue a career in hospice in the in-home care setting. There are many reasons why hospice is referred late for a patient. I'm going to talk about 2 of those reasons. A solution cannot be found unless you know the true problem. A referral to hospice is delayed due to lack of information, which causes the family to feel a need that they do not need, feeling that they do not need hospice. I have often heard patients and families state, "We don't need that just yet." A second reason for hospice being delayed is that no conversation happens at all. Lack of conversation could be caused by fear of both parties, the patient and the provider, and can lead to misunderstanding of to what hospice is and what they truly have to offer. The American Hospice Foundation has goals to raise awareness about hospice and debunk the myths that come with it. They state the hospice remains a mystery is due in part to our society's resistance to discuss the matter of death. Majority of our providers are unsure of what to even talk about. A survey of 736 physicians out of the 50 states was done by the John A. Hartford Foundation, finding that only 29% reported actually being educated on how to have the conversations about end-of-life care. The theme between these 2 reasons seems to be lack of conversation. The hospice conversation should truly be done by the doctor. CMS guidelines, or Centers for Medicare and Medicaid Services, are the true rule makers of healthcare. They state that beneficiaries, or the patient, must be certified by their attending physician and by the hospice physician as terminally ill with a life prognosis of 6 months or less, as long as the illness runs its natural course. Through conversation, the provider and the patient can break down barriers about what hospice truly is. We also need to train our providers on how to have these conversations. Getting education into the rotation on how, what, and when to say about death and what it can look like will help to open the conversations. If we start to educate in medical school, all providers, no matter what direction they go, will receive proper education on how to talk about the dying process. Dr. Atul Gawande is a surgeon, a professor at Harvard Medical School and Harvard T.H. Chan School of Public Health. He's a staff writer for The New Yorker and a best-selling author. He writes, "The way we saw it and the way our professors saw it, the purpose of medical schooling was to teach how to save lives, not how to tend to their demise." He then writes, "I encountered patients forced to confront the realities of decline and mortality, and it did not take me long to realize how unready I was to help them." If we do not educate the one person that's supposed to help our patients, how do we expect them to receive care in an appropriate time frame? So what's being done about this problem? American Hospice Foundation is working on educating the society about hospice. They're providing education to employee assistance professionals, psychologists, and pastoral counselors, because they're the ones that tend to work with people on grief and the death and dying process. If we're not educating our doctors on how to have these conversations, how do they know when to make these referrals and to have these conversations with patients? If the doctors are the drivers of care, and we need to educate them equally on how to have on hospice. They need to be taking care of us from our first breath to our last breath. Meg Dahitri, an RN and CEO of NVNA and Hospice Norwell, Massachusetts, writes, "The delay in services symptoms are still managed by relationships, but relationships are not established, and care of our transitions are given in crisis. This can cause anger for families and disappointment for staff." It is interesting to think that through education and conversation and personalities, quality of life can be drastically improved. A delay in hospice care is unnecessary at times. Through purposeful acts, the delay could be eliminated, increasing a person's quality of life. As technology continues to improve, we witness a decline in conversation. Open and educated conversation can be the solution to many problems. Let educated conversation be the building blocks to our bridge as we attempt to cross from quality of life. Thank you.